The voluntary assisted dying provides a framework that provides safety and security and safeguards so that there is second opinions in place, there are appropriately trained medical professionals involved in the process, there is a review and approval process that takes place, and it is a far more robust framework than what you might see in other healthcare settings.
Today, I speak not just as a Victorian, but as someone living with motor neurone disease, a progressive and terminal illness. It's a condition that gradually strips away strength, movement, and ultimately independence. It doesn't take my mind, but it does take my body. And like so many others facing this illness, I must look at my future honestly. I may one day choose voluntary assisted dying. That is not a decision that will be made lightly. It's not about giving up. It's about retaining agency over the most personal decision any person can ever make: how they leave this world.
My starting point is this. Every Victorian, in my view, deserves to be loved, to be valued, and to be respected. And while I acknowledge there are deeply held views on this matter, I have formed the view myself that the majority of government amendments proposed in this bill do not have my support.
Presently, clinicians cannot mention that VAD exists unless the patient knows to ask. And we've heard many examples from many community members that some have gone by without actually knowing or acknowledging that they've had the opportunity to make such a request. There is no other area of medicine where a doctor must withhold legal information from their patient. By removing this, access to the scheme is much more equitable.
When the Voluntary Assisted Dying Act passed in 2017, the Labor government called it the safest in the world with 68 safeguards. Now the government is attempting to remove those same safeguards despite there not being public demand and also no clinical evidence to justify it.
Despite assurances that crossing that Rubicon in 2017 would not result in a creeping process of wider eligibility, what might be termed the slippery slope, here we are only a few years later, within the life of the same government, where those safeguards are now barriers and those essential protections apparently undue hindrances for Victorians to be either euthanised by a health practitioner or to access self-administered assisted suicide. In seeking to remove those safeguards and protections, this bill will necessarily render Victoria's VAD laws less safe for both patients and the health practitioners who facilitate them.
Well, currently you need a prognosis that you're likely to die within 6 months to access VAD, or 12 months for some conditions. The bill proposes to change that to 12 months overall, which is a much more reasonable time frame.
I note that this debate will never entirely be settled and that deep and ethical questions of morality can never be answered to the satisfaction of every single individual. But as policymakers, we face the same dilemma that healthcare workers face when confronting this issue. We must grapple between the competing priorities of the preservation of life and the alleviation of suffering. These are never easy questions to answer, and nor should they be, but I believe this bill strikes the right balance.
The reason I couldn't bring myself to vote for this bill the first time around was because I didn't think the safeguards were sufficient to prevent the possibility of abuse. My concern is that while there is one safeguard here I absolutely support, I think the other changes are actually widening the guardrails and reducing safeguards. And on that basis, I'm not able to support it.
During the course of the past week, I've spoken to as many experts as I can, including an oncologist who administers VAD, the head of palliative care in a large public hospital, both of whom have concerns, as well as nurses, nurse practitioners, palliative care doctors and nurses, doctors who conscientiously object, geriatricians, aged care workers, people with neurodegenerative diseases, people with terminal cancer, community leaders, older people, friends, carers and widows. And I think further time would allow the opportunity for experts experienced in all sorts of care to come together and make fully informed and considered recommendations for both VAD and palliative care.
This isn't about expanding access to death, it's about extending and expanding compassion for those who are dying. As I've said, we've heard directly from those with a terminal illness that people know that when they have a choice, they live their remaining time with less fear and more peace. Doctors and nurses tell us what a difference it makes, not only for the patients that they're caring for, but the families who can share stories, hold hands and say goodbye without panic or pain.
I will say now that I'll be supporting this bill as it goes through the Parliament. I'll be looking at some of the amendments. I'll hold my position on a couple of those, but the rest of it, I think should be going through, and though people in Victoria should be getting the choice they deserve.